Hi, Dr. Greg Uchas here, Clinic Director of Proactive Health Group here in downtown Calgary. I'm here today to talk to you about our functional movement examination. Now, all motion is ideally based on proper, efficient, functional movement. When this happens, we tend to function very well. We tend to not get injured, we tend to be more powerful, we tend to be stronger. But in many instances, we alter the way we move. We compensate. Now, if we do this once or only a few times, the body can truly accommodate. But this doesn't happen very often. We often do these repetitive motions over and over again, ultimately resulting in achiness and in almost all cases injury. We see this in everyday life. Let me give you an obvious example. Have you ever seen anyone on a running path and they have atrophied gluteus muscles? They have no bone. If you were to look at their hamstrings, you would see that they're overdeveloped, that they're sinewy. And if you asked, I bet you that runner would tell you that their low back's sore. They're just moving improperly. Functionally determining the inefficiencies in a person's movement is crucial, and it's achievable. There are three things to consider. First, we need to find the movement pattern problem. Two, we need to understand why it came about. And three, we need to correct it. At Proactive Health Group, that's exactly what we do. Our focus is on a functional movement examination that looks at all the different movement patterns of the body and looks for inefficiencies in movement. Then, we collaborate with trainers to correct those different movement problems. There are so many advantages to this. One, there's better buy-in for clients. Two, when a client gets injured, that discontinuation of the membership tends not to happen because we advocate with the trainers for speeding recovery of these injuries. Three, a collaborative approach for a client tends to provide that greater buy-in and ultimately long-term benefit. We truly advocate lifetime supervised training, better exercise program design, and analysis of proper movement. That way, people simply don't break down. The functional movement deep dive, along with collaborating with trainers, is in short,